My name is Carlene Shedd, and I live in New Buffalo, Michigan. I got the call from my colonoscopy after the pathology reports were in, and they said, yeah, you have cancer. And I was just like, really? Me?
My name is Dr. Konstantin Umanskiy. My subspecialty is colon and rectal surgery, and I've been here at the University of Chicago Medical Center for almost 2 years. Mary came to me referred by a gastroenterologist with a new diagnosis of cancer. She came to me as a second opinion because she was told by her gastroenterologist that the University of Chicago Medical Center is the place where we can provide her with the best and the most current surgical treatment of her condition.
As soon as I met with them, I knew that I was in the right place. Whenever my husband and I went to have the consultation with Dr. Manski, he was very generous with his answers and with his time also. I never felt rushed with him. Everything was very accessible. Dr. Umanskiy's staff was really on the ball with getting my appointments, getting me in. He explained to me, you know, what I was looking at, what everything was. And so that gave me a real sense, too, of what was going on. It wasn't like an innate object out there in space somewhere. It was right there for me to see also. Dr. Manski was trying to describe the procedure of putting the colon back together, and the instrument that they used is actually a stapler. And my husband, being, you know, mechanically minded, he was trying to get a sense of how that would work. And so Dr. Manski drew him a diagram of exactly what that instrument looked like and how it would work. And then my husband was thrilled. He was like, okay, I understand exactly what you're saying now. I really appreciated that.
I usually give them the drawing to take home, and they take it home, and I don't know what they do with it, but the patients like it. So I always try to draw the picture. And then when they ask questions, I use the same picture to explain things. And I think it helps tremendously them to understand what we do and how we do it. And a lot of what we do, and being a doctor, comes from the Latin word teacher and educator, is what we do. We educate patients. We spend a lot of time during our consultations actually explaining what the condition means, what are the potential outcomes, and then we talk about what are potential treatment scenarios. As they progress through surgery, they feel a lot more comfortable because they know what is going to happen to them, how they're going to progress, what to expect, and they become very active participants in their recovery. In Mary's case, the tumor was right here, close to the very end of the bowel. And I said to her, what we will need to do, we'll need the following thing. We will need to remove the portion of the colon in this location, and then here.
My surgery was August the 24th, and I had colorectal surgery. I had 12 inches of the colon removed. I feel good. I think everything healed nicely for me, and I feel just good that everything went as well as it could have gone. You know, it was very just a professional atmosphere, what you would really expect from every medical center. Unfortunately, you just don't get it at every medical center.
Physicians, scientists, nurses, radiologists, pathologists, all of us together as a group provide this outstanding, comprehensive care for patients in our specialty, which is not available elsewhere.
I came, and as soon as I walked in the door, I knew that it was the right place for me. Discover for yourself.